Yes, it's clear.
Fantastic. So thank you all for joining. My name is Mike Penkunas. I'm a research fellow at the United Nations University International Institute for Global Health, also known as UNU-IIGH, and we're located in Kuala Lumpur, Malaysia. I'm a research lead here, and I manage our program of work around strengthening capacity for local decision-making. And so for those of you who may not be familiar with UNU, it is a network of 14 United Nations think tanks. And UNU-IIGH is the designated UN think tank on global health. Our institute serves as an academically independent research and policy translation hub for UN member states, agencies, and programs. So I want to sincerely thank you for joining us for our webinar today. I realize everyone is very busy and that you have limited time in your day. So I appreciate you choosing to spend the next hour or so with us all here on Zoom. This event is a culmination of a project that we began last year in collaboration and with support from the Special Program for Research and Training in Tropical Diseases, also known as TDR. And here we've gone to great lengths to map the landscape of implementation research training for learners, specifically in low and middle income countries. We know that implementation bottlenecks are often the most pervasive in LMICs, where health systems can lack the internal capacity needed to collect and interpret data on which health interventions work, which don't, and why. Implementation research is a powerful tool for identifying and addressing bottlenecks, inhibiting the success of proven health interventions. There are an ever-growing number of implementation research training initiatives out there, although the majority of these do remain out of reach for many investigators in LMICs. This is troubling because it is these investigators who truly possess the knowledge required to contextualize those challenges as well as the potential solutions, all in light of the interacting community and system level factors at work. This project that we're diving into today culminated with a realigned implementation research training framework that is informed by and built upon the work that we've carried out over the past year and a half. Our team has put a lot of effort into this project and also into this webinar, and I genuinely hope that the next hour is useful for you and for your work. Before we jump into the substance of our program, just a couple very minor housekeeping notes. First of all, we've enabled the Q&A function, which you can find there at the bottom of your screen on that lower toolbar. Please don't be shy. You can write your questions in there. There's also an upvoting feature. Please do utilize this throughout the webinar. And we have scheduled some time at the end of the hour to take questions from the audience. Secondly, my colleagues will now paste the link to the report in the chat box. And this report accompanies the webinar. And you can click on that link at any time to automatically download the report. So with that, I want to very briefly go over our schedule for today. I'm joined by 3 other panelists for today's presentation. First, we'll hear from Dr. Pascal Lenoir from TDR, who will give us an overview of the inspiration for this project and why we did what we did. Next, we'll hear from Dr. Xiaoyun Chang, a postdoctoral fellow at UNU-IIGH, who will walk us through a bit of the methodology that we used throughout this study. And then we'll hear from Dr. Evangelia Berdu, who will give us some of the high-level results from our study, along with some examples illustrating those results. And then I will wrap up with a brief discussion of what is in the pipeline and a model training program for us to discuss. With that, I want to hand over to Pascal from TDR. Please, the floor is yours.
Thank you, Mike. Good morning and good evening all of you. I think my role here will be just to give a brief overview of the TDR, what TDR is doing. TDR is the special program for research and training in tropical disease, where I'm a training manager, and I'm in charge to develop implementation research trainings for low and middle income countries. So I will give you a brief background why we collaborate with the UN University just to develop this framework. So it's almost 10 years ago, TDR moved its strategy to implementation research. And we spent a lot of time just to develop our definition of implementation research. Because at this time, there is a lot of implementation research, and we have to choose what are our definition of implementation research. And after a lot of discussion with a stakeholder in the field, the definition was that the systematic approach to understand and addressing barrier to effective implementation of health intervention strategies and policies. Next one. So what we want to do is just to identify bottlenecks and challenges to implement some health intervention in low and middle income countries, just to identify some solution and to test it. So for us, what's really a challenge is that the implementation research is conducted in real life system and community setting. It's not like a clinical trial where everything is really in hands and we know exactly what we want to do. It's different in real life setting and removed from control settings. And what we want also for this implementation research is to provide evidence to support scale up of interventions, and not only to scale up of interventions, but to policy change. So we want to implement our result in the field. Next, please. Next slide, please. So for that, we have two main schemes. The first one is a postgraduate training scheme that focus on implementation research, and 7 universities are involved. And I saw in the list of attendees that some of you are PI or are part of this activity. And the second one is the regional training center, supported by TDR, one by WHO region. Next one, please. So as I told you, we have identified 7 universities around the world, 3 in Africa. We have at the University of Ghana, at Wits University and the University of Zambia. 1 in Latin America, which is the National School of Public Health in Medellin. 1 in Mediterranean region in the American University in Lebanon. We have 2 in Asia, 1 in Bangladesh at the School of Public Health at BRAC University in Dhaka, and 1 in Indonesia at the Gadjah Mada University in Yogyakarta. And since 2015, we are able just to train more than 200 masters on public health with a focus on implementation research. And you can see below here the distribution of the different masters. So TDR is supporting these postgraduate schemes in terms of implementation research. Next slide, please. The second one is the supported 7 regional training centers. The objective of this scheme of supporting regional training center is to institutionalize in this institution a training package of short courses in implementation research that I will describe a little bit later, and to disseminate this series of training courses in the region through what we call satellite institution. So we have also identified regional training center. I think some one in by WHO region. For the Latin American one, we have a research institution which is called CDIM in Cali, Colombia. For Africa, we have the University of Ghana, the School of Public Health in Ghana. For the Mediterranean region, we have the Institute Pasteur of Tunisia. For Euro, we have a regional training center in Astana, in Kazakhstan. And we have one regional training center for the Syro region, which is the Gadjah Mada University, and one in the Wipro region, which is a consortium, which is the Malaysian Global Health Consortium, which is a consortium with three members: the University of Malaya, the IHSR, and the United Nations University, and the International Global Health Institute at the UN. So we have this regional training center for one by WHO region. Recently, we have also selected a specific regional training center, a sub-regional regional training center for French-speaking countries in West Africa. And it's at Cheikh Anta Diop, the university in Dakar in Senegal. And its role is really to train scientists in implementation research from French-speaking country, because what we see from our previous evaluation of the regional training center that we miss to target this audience of French-speaking country due to language barriers. And here you can see the networking activity that we have, that the different center has with different countries in the region. For example, the Ghana University in Ghana, the regional training center supported for Afro, has a link with Kenya, Mozambique, and Togo and Benin also, but also in Nigeria. For Latin America, they were able just to disseminate the training courses in different regions in South America, but also in Latin America, and even in the Caribbean islands, because they are working with Jamaica. So what we want to do is just to develop some networks. The last objective of the goal of this regional training center is not only to institutionalize these courses and disseminate it, but also just to develop a network on implementation, on training on implementation research. Next slide, please. And just to show you what we have at the moment in our portfolio in terms of short training courses, typically on implementation research. We have a MOOC on implementation research with a focus on infectious disease of poverty. It was launched in 2018, and since that we have 21 sessions, mainly session in French, in English, and in Spanish. It's completely translated, and we are in the current process of translating it in Russian, in Chinese, but also in Arabic. And the objective is just for the participant to get the knowledge on the principle in implementation research with example coming from the field. We have another one, which is a short course, face-to-face, on basic principle in implementation research. And the objective is just to go a little bit more deeply than in the MOOC in principle in implementation research. It has been developed by the network of regional training centers led by the School of Public Health in Ghana. And it was developed at the beginning as a face-to-face training, but due to the COVID-19 situation, we are currently developing it as an online course, and it will be piloted next week. We have another training courses, which is the TDR toolkit on implementation research. And the TDR toolkit is it was the first tool developed in implementation research. It has been identified as one of the best tools just to develop proposal in implementation research, because it's really its objective just to help participants just to develop a good proposal in implementation research. We have developed recently some not training courses. We have developing some interactive document on implementation research just to identify the ethics challenges we're doing an implementation project at different stage of the project. Before the project, during the project, and after the project. For the moment, it's just an interactive document that is on the TDR website, but next year, we will develop it as a really short training courses, either face-to-face or online. It will be a little bit difficult for us just to develop online because ethics is really based on interaction and a discussion, and we have to identify a process just to improve the interaction between the different participants. And what we have is just this publication guidance of the implementation research. And all these activities is really supported by the regional training centers. This is a series of package of training courses, but each regional training center have the possibility just to customize this training package for their specific audience. Next slide, please. So you see, we have this series of training package, and it's. I think we are quite successful. For example, last year we trained more than 3,000 people in implementation research with the different training tools that we have in our portfolio. But I think all this training has been developed during the last 10 years. And we have now to not make a pause, but just to add the question and to identify principles and priorities for the next investment of TDR in implementation research training. So what will be what TDR has to build to really construct a strong package of implementation research training needed for the participant from low and middle income country. So it's a reason why we have commissioned the Malaysian Global through the UN University to map the training in areas that are available around the world, and to identify what are the challenges and the opportunities, what are the gaps, and to help us to design more appropriate training program on implementation research. And I will not go a little bit more, I will not go in more details in this topic, because it's really why we are here today. It's just to show you the result of the framework of IR. We will allow us just to develop our next strategy in implementation research, and just to for responding to the needs of the scientists from low and middle income country. And I will not go in the methodology and the result, because it's why we are here. So, and next slide, I will stop with the last slide. That I would like to thank all the funders that are participating to this program, and the funder that help TDR just to develop their training activities. And you can find, if you are interested, to the different funders at the list that I gave you. Thank you very much.
Thank you very much, Pascal. And we appreciate you setting the stage there, giving us some background on the work of TDR, the IR training packages, and giving us the inspiration for why we did what we've done over the last year and a half or so. With that, I'd like to pass the floor over to Xiao, who will describe for us some of the methodologies that we utilized, as well as a bit of the considerations when putting together the synthesis from our results. So Xiao, please, floor is yours.
Thanks, Mike. Hi, everyone. I'm going to give an overview of the process that involved in the developing of the IR Framework 2.0. We first started the process in early last year, where we did a literature search in Scopus and also a search in gray literature. And we identified three main training modalities that are currently available. The first one is the formal academic course, which is available in university as part of a component of a master program, for example, a master in public health. The second is a project embedded approach. And the third one is the short courses, which are available in online or face-to-face training. We also involve 10 qualitative interviews with leading IR educators. We identified those IR educators from the literature review that we did earlier. And from global scan and expert interviews, we identified some of the areas that need further training, further development in IR training. In September 2020, we conducted 4 workshops with IR experts. There are 2 workshops, and each workshop will run at 2 different times so that we can accommodate participants from different countries. The first workshop focused on the successes and the challenges of the current IR trainings. And the second workshop focused on prioritizing the challenges and identifying the solutions for the challenges. The process from global scan, expert interview, and virtual workshops are actually iterative, in which from the global scan and expert interviews, we identify the gaps. And with the workshops, we validate the gaps, and we also highlight some of the issues that we missed earlier. After that, we prepare a report for peer review, and we get a feedback from 4 peer reviewers. Next slide, please. I'm going to give a bit of overview about how we synthesize the findings and the write-up of the report. Basically, there are 3 main principles that we take into account when we are trying to develop the framework. The first one is we try to build on what has been achieved, what are the resources currently available, and we try to make the dots connected. And in the same time, we also try to highlight some of the approaches that are not working so well and why they are not working so well at the moment. The second principle is that we try to develop a cohesive and clear framework to address the pressing IR issues, but also recognizing that the framework needs to be adapted according to the needs of different organizations and in different regions and different countries. The third principle is that we try to suggest some easy wins to some of the practical, to some of the issues that we identified earlier, and some of the solutions to tackle the problem. But also at the same time, we provide some indication where we think more efforts are needed. I'll stop here for now. Thanks.
Xiao, thank you very much for that clear and concise presentation going through our methodology and some of these considerations to balance. Next, Evangelia will walk us through a bit of the results and some key examples to be highlighted over the next few minutes. Evangelia, please, over to you.
Thank you, Mike, and good morning, good afternoon, or good evening, everybody. I've been involved in this work as an external consultant, and I've been fortunate enough to be to have worked on this since almost the beginning of the project. So my goal today is to give you like a very sort of high-level overview of the framework itself, and also unpack a few specific components in order to allow you to get an understanding of how the framework works in practice. So the framework is built around 2 main areas of challenges and opportunities. The first area is the pedagogical challenges and opportunities, and these relate to improving on what is being taught, to whom and how. And in a sense, these are sort of challenges and opportunities that are more easier to grasp because they're more concrete. And the second area has to do with broader challenges, institutional challenges and opportunities. And these are barriers that prevent the sort of scale up not only of IR training, but of the of implementation research itself. And generally speaking, these are also issues that are more difficult to tackle and which may need like a more concerted sort of effort and approach. So the pedagogical challenges, one of the first things sort of that jumped at us and which was confirmed by the discussions in the virtual workshops is that, you know, like these modalities that Xiao briefly mentioned, the online courses like TDR's MOOC, and the more academic sort of programs, like the one that TDR is supporting in its centers, or the short face-to-face workshops. They're all involve learners with very diverse backgrounds, interests, and also who are at different points in their careers. Some of these individuals may have a grounding or a little bit of grounding in social research. Others may come from a more clinical background. Some of them, you know, take advantage of existing resources as part of a formal course of study. Others, you know, sort of try to teach themselves in evenings, you know, like in sort of apart from sort of what they're doing at work. Others are sort of doing it with the blessing of their employers. You know, they have the capacity to take 4 or 5 days off to attend the 4 to 5 day workshop. And you know, like also the life circumstances are different. Some of the students that they have caretaking responsibilities, so their time is quite limited, and so on and so forth. Another thing sort of that we got to realize quite early on is the majority of approaches are meant to train individuals and not IR teams. And that is quite important because we know like the importance of working as part of the team in an actual implementation research project. And the third thing, the third finding that we felt was very important is that in general, the learners who complete a formal or informal course of study, they lack opportunities to practice and to refine what they've learned. So to address this kind of challenges, we provided examples of potential solutions for each one, and these are quite sort of covered in depth in the report. These are some of them are not straightforward. You know, there's some dilemmas about where to place the emphasis on, but we tried to be as constructive as possible. So and I know that certain things are also underway on the part of TDI that Mike is going to talk about. The institutional challenges have to do, the first one has to do about the lack of awareness about on what the value of IR is and what are the questions that it can and cannot address. And this lack of awareness is especially important when we're thinking about sort of decision makers, and I'm using the word very broadly. These are decision makers, and not only like on the implementation policy side, but also people who make decisions about how a research budget should be spent within a given organization. And this whole organizational side of IR and IR training, we felt that needed more attention because individuals in and of themselves really cannot, it's very rare that they can, someone who is working in an organization and has benefited and has learned general principles and the tools are around IR to be able to then sort of initiate an IR project. They need to get buy-in from the managers. It's a complex process, even just putting together a proposal within an organization for funding for IR is a time-consuming process. So in order for IR training to sort of be used to put into practice, we need to ensure that there is organizational there is buy-in at the organizational level as well as support. And sometimes, sort of people who are responsible for the budgets and high-level managers are hesitant to invest into a new sort of line of research because they might have already like a well sort of set out and functioning monitoring and evaluation framework. So these are all things that we had to consider. The third point, which sort of kind of builds into that sort of, we need to think IR in relation to organizations. We also need to think IR and IR scale up and training in relation to its contribution to building regional research capacity. And that is because most of the trainings and the resources that we have identified, they seem to be a little bit disconnected in the sense that, they try to build up the capacity of individuals, but then how do they help advance capacity building at sort of organizational, but also at the regional level. So this is about thinking more strategically about the way that all these different investments add up into improving the capacity of a region. Next slide, please. So I chose two examples to explore in a little bit more detail for the purposes of this report, and also to show that although we make the distinction between pedagogical and institutional challenges and opportunities, these two areas actually are connected. Yeah. So I talked about the diversity of IR students' backgrounds in terms of epistemic backgrounds and goals and interests, what they want to get out of the training, and also like in terms of their availability. So the key sort of idea that we put forward in the report is that there is a need to maybe reorganize the resources that already exist so that learners can develop their own personal pathways to learning. So just to give you an example, what we mean by that is, say that someone is interested in learning more about IR, but comes from a more sort of clinical background. So that person, they might need to get their heads around like social research around health systems before they are being, they delve more specifically into IR. So and this sort of personalized pathways to training, they can take advantage of resources that have been specifically developed for IR, like the MOOC and all the other the guidelines that sort of and that TDR and others have developed, but they also can draw on other freely available resources. Yeah. So and some aspects about the like when it comes to more sort of these resources being a part of the more formal courses of study, there might be institutions like TDR can set some sort of criteria, like you can only be sort of get the certification for an online course if you have successfully completed a certain sort of a series of modules and in a specific way, in a specific sequence. And we believe also that this will help with the fact that another challenge, which is, that we usually try to cram too many things within the courses themselves. And so modularizing, like breaking up the content, might be a good idea to allow people to learn on their own pace. So that on the institutional side of things, we in the report we talked about how important it is to introduce certain types of programs that are specifically designed to strengthen organizational capacity building within an organization. So there's certain sort of people from an organization can sign up to attend a series of courses on IR, and they're also supported in doing so from their management. But also how important it is to try to align IR with other investments in applied research that have been made within these organizations, and show people, indicate the different ways that IR can take advantage of existing tools and information flows and also contribute to them. And one of the most sort of obvious such types of applied research is the kind of existing monitoring and evaluation framework. So I think this would also be, will also make it easier for IR to be integrated into practice, because then the management will not see it as something, another new thing that they need to fund from scratch. And a way that the way that we see these two challenges connected is that if there is organizational buying, if there is an ongoing research build capacity within our organization on IR, this will open up the space for more people to take advantage of the courses available. And so there's like, the pedagogical and institutional kind of go hand in hand. And also is quite important for, like, it will be also a way to boost demand in IR itself from the organization's side, because we know that there's very few jobs dedicated to IR, at least in lower and middle level income countries. So all this and more you'll be able to see in the report. And yeah, I hope that very quick overview gave you a flavor of what is it that we try to do. Thank you.
Thank you, Evangelia. And that's a good reminder for everyone to please use that link in the chat to access the report, where you'll get all of this and more in detail. Now, just to sort of wrap up our session today, I want to spend a few minutes to discussing some of the new and ongoing initiatives that are a bit of a spin-off from this landscaping project that we're now concluding. So here I've highlighted just 5 individual projects. There are actually more, but these 5 I wanted to discuss briefly, and these are all in one way or another, directly or indirectly, inspired by the landscaping work that we've discussed today. So the first one there is a gender and intersectionality in implementation research module. So here we're hoping to leverage a lot of the conversations that are happening now in gender equity and health, and integrate those conversations into implementation research. I think this is an avenue that can be quite fruitful if done correctly. And so here there's going to be a new module, which will be an add-on to the current TDR MOOC on implementation research. Next is around community engagement for implementation research investigators. We know that community engagement is a very important part of IR. It is critical to the success of IR, but there really are limited opportunities for formal training around community engagement. So developing a module around community engagement, through this, we hope to fill some of this gap and to be able to instill a skill set amongst investigators around appropriate and high quality community engagement. Next, we're also working on a mini MOOC for implementers that will be about an hour long once finished. So we've discussed here a lot of resources and opportunities that are available for primarily researchers. But when we think about that implementation research team, it is more than just researchers who operate on the team, including implementers. So through this MOOC, this mini MOOC, we hope to educate implementers on how to best cooperate and collaborate to fill a specific role within that implementation research team. It's a bit of the modularized learning that Evangelia introduced us to before. Next is around the geographically representative and also disease-specific case examples that are underway. We have quite a large library available from sub-Saharan Africa as far as implementation research studies go. We also have a high-quality library of case examples around HIV, TB, and malaria. But we have many fewer walkthroughs available for other geographic regions. So now the regional training centers mentioned by Pascal Lenoir and others are working to help fill these gaps. So creating regionally specific examples, walkthroughs for learners from areas across the world, as well as some deep dives into neglected tropical diseases and diseases endemic to different regions, to give learners from those regions a high quality example that resonates more closely with them than perhaps examples or walkthroughs from other regions. Lastly, I wanted to highlight a virtual mentorship pilot that we're just now wrapping up. This is through the Western Pacific Regional Office, who hosts a small grant scheme. And we had noticed previously that mentorship was a reoccurring need, often brought up by individuals who undergo implementation research training. And I don't think this need is unique to implementation research, but is common across all types of scientific inquiry. So it's not just IR researchers who have a demand for mentorship, but across the scientific spectrum, this is true. So here we've shifted a lot of things to a virtual space through the pandemic, and we tried our hand at a virtual mentorship program for these investigators, which I think was particularly useful for new investigators, be they early career professionals or investigators that are shifting their focus perhaps from a clinically specific area of inquiry over into implementation research. And I just want to note that these are happening almost in parallel to our landscaping, so that the gaps that we've identified can immediately be filled, at least attempted to be filled through some of these tailored programs that are now ongoing. Lastly, before we wrap up, I want to present here a theoretical, a hypothetical, a model training program that will, I think, resonate after Evangelia, Xiao, and Pascal presented their pieces. So here in the center of the training program is that IR team. And we did this to really put the spotlight on the team as the unit of training. So in that orange oval, you'll see researchers, implementers, decision makers, monitoring and evaluation specialists, and the team can come in many different compositions, but here is the team being used for this example. And then to the right, you'll see those 4 individual arrows, which represent those personalized learning pathways that could be coordinated through the modular content that also was brought up by Evangelia. And through here, that leads us to the first oval to the right-hand side of the slide, which is really the component around the didactic training. So thinking about workshops, postgraduate training courses, also the MOOC that was mentioned earlier, as well as the toolkit, and now the growing library of online mini courses. And these could be tailored, as brought up earlier, to the individual needs or the interests of the people who make up the team. Sometimes you might hear me say that not all policymakers need to know how to do a step wedge control trial, and I think that's true. But for example, implementers could be quite good at helping to identify those bottlenecks and areas where community engagement is most relevant. Now, this is opposite on our figure to the small grant award. And in that circle, I'm highlighting opportunities for learning by doing. And so through a coordinated small grant that goes to the IR team throughout this training model, it represents an opportunity for the team to carry out implementation research in action. So this learning by doing component. And it also gives an opportunity to use that training concurrently. So as the didactic training is taking place, the protocol, the data collection tools, policy translation, thoughts and processes are also happening for an actual project that will be carried out. And so this is represented through that double-headed arrow down there in gray, where it's noted this can be concurrent or just-in-time training. And now below this, I've represented a foundation built upon the regional training centers and the postgraduate training schemes, also highlighted by Pascal earlier. And we have here a wealth of expertise in implementation research. And as I noted, there is a high demand for mentorship. And so through these regional training centers and other institutes where a pool of expertise exists, they could be hosting the workshops, working to improve protocols and proposals, as well as providing that much needed mentorship. And importantly, also giving an opportunity to build networks and to have relationships be built amongst research teams themselves. And then lastly, I have this dotted line that goes from the box at the bottom back up to the IR team. And this is to represent a two-way flow of individuals, noting that those who are currently participating in the regional training centers or in this postgraduate training scheme, also funded by TDR, could then go on to participate in a training program like this, the team-based training program. And also those who are engaged in the training program can connect back with the regional training centers or undergo additional educational certification through the postgraduate training scheme. So again, this is a theoretical model, but I hope you can see some of the pieces coming together, and to note that this is not a grand overhaul of implementation research training. What we've tried to do here is take those high quality components and realign them and provide linkages so that the team becomes the unit of training, but also can leverage all of these high quality materials that are already available, as well as the pool of expertise and knowledge represented through our regional training centers, as well as the postgraduate training scheme universities. So with that, I want to sincerely thank you for your attention and for attending, sharing an hour with us here today. We do have a few minutes for a couple questions. I saw a number were coming through on our chat. So if we have one or two to field, now's a good time.
Yeah, I've been monitoring the Q&A and also the chat, so I can sort of bring to your attention to everybody some of the questions being raised there. So one of the questions is by Catherine Iglesias is whether we suggest in the framework which grants or funding organizations can sort of IR training participants turn to in order to carry out new projects, or is that beyond the scope of the frameworks? Yes.
Good point. Thanks, Catherine. I think what we would like to do is encourage the connection of training grants with, small grants or new project grants with capacity strengthening initiatives. So the ability to link them would be quite impressive and appealing. And that's really up to our different donors that operate in this space. Pascal, you have a comment to add, please?
Yeah, I think it's just a short comment. I think following the result of this framework, and particularly in this topic, and that there is really a need for the participant of our different training program just to apply the knowledge by learning by doing. And what we are piloting now with the regional training center in the WHO Southeast region. And I think that Dr. Yodi Mandandahata is one of the attendees. We are working with him just to link the MOOC on implementation research with a small grant. In other terms, at the end of the MOOC, we are asking to the participant to send us a letter of intent, which is the first step of a research proposal. And this research proposal are scored by the peers, peer reviewed, or by the participants of the MOOC. And what we would like to do is just to identify the best one and to give them more training and to develop a full proposal and to apply this research proposal in the field, just to have a research project funded, I could say. It's a pilot now this year in the Southeast region. And if the lesson learned are positive, we will extend that to all region next year. So just to show that we are putting in the concept in action, I could say.
That's great. Thanks, Pascal.
Another question from Kondo Aquela Rada, and apologies, I'm sort of butchering everybody's name. He asks, as a PhD student, how can we implement our research findings since it is more difficult to interrelate with the decision makers?
Great question. I think that goes back to our conversation around the research team. And I think one of the key concepts is to have our decision makers be a meaningful part of that team. And so it is a challenge to get results translated into action when researchers are working independently. And so it also relates to how do we have engagement early as we design projects and really do a demand-driven type of research. So it is a challenge. Pascal?
Yeah, the best situation, I think I can say the best situation is to engage the stakeholder and particularly the implementer from the beginning, very early at the beginning. And if you want to translate your result very aptly in the field and with the implementers, you have to identify a challenge with them and to try to respond to the challenge. Because if you are going with the research project, your own project, and that did not respond to a need for the implementer, you can forget it. I think you have to respond to a real challenges issue coming from the field and from the implementers. And like that, it will be easy just to work with them to do the research and to implement the solution that you are identifying.
Absolutely. I couldn't agree with you more, Pascal.
And the third question from Harvey Liwanan from UNU is how do we know if we're trying to measure, if we're trying to strengthen our capacity, then how do we know if we're successful? Like what metrics can we use?
Yeah, another good question, Harvey. This is something that we've been engaged in a little bit. I hope Pascal can also add on to this. There's an ongoing evaluation of the implementation research MOOC that is designed and hosted by TDR. So looking at 4 different levels of capacity strengthening. And so thus far, using this multi-level evaluation technique has shown that the MOOC has been quite successful in changing people's capacity, improving people's knowledge of implementation research, but also how they apply those concepts into their everyday practice in their professional life. So this is an avenue that's ongoing, but the evaluation, I think, is very critical, especially as sort of applied educators. We're applied researchers, but also applied educators to see where we are really excelling and perhaps other areas that we're falling short. Pascal, did you have any other insights on the metrics?
Yeah, I think for that, I think every I think capacity building program has to be monitored and evaluated. I think just to improve, not only just to evaluation for the evaluation, but for the cycle, just to improve the next step of the training program. And for the in TDR, for this capacity building activity in IR, we have developed what we call a theory of change with some indicators. And to populate this theory of change, we have developed what you describe, and in the first step, the evaluation with the evaluation model, which is a Kirkpatrick model, which is used for training activities for the MOOC, and we can populate that. So, but as I said, that every capacity building program or strengthening capacity program has to be monitored and evaluated. TDR has developed training courses in monitoring and evaluation of capacity building activities. We pilot, it has been built with the Barcelona Institute of Global Health in Spain, and it has been tested face-to-face last year and online this year. I think we have to refine a little bit the training, but it will be available for monitoring, evaluation, capacity building activity next, I think at the end of this year or at the beginning of next year. So monitoring evaluation should be part of the project of implementation research from the beginning also. You have to develop your framework of monitoring and evaluation.
Great, and thank you, Pascal. With that, I see we've reached the top of the hour. A couple comments there around the recording of this webinar. So yes, this will be made publicly available on the UNU-IIGH YouTube channel. So please do watch that in the coming weeks. Other than that, I want to sincerely thank you all for your participation and for your attention. Thank you for joining us. Thank you for your questions. Please do, if you have comments or feedback, get in touch with us at TDR as well as at UNU-IIGH. Lastly, I want to thank Pascal Lenoir and colleagues at TDR for their ongoing collaboration and support in this project. Without them, this could not have happened. Thank you all very much for attending today, and I wish you all a very good evening, good afternoon, and good morning.